The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. You are listening to Itchy and Bitchy, a podcast that provides answers to your many health questions. I'm Karen Nickel, family nurse practitioner, and I'm going to talk to you today about bacterial vaginosis, or BV. Last night, my husband and I were having dinner, and he asked me, "So, what are you going to talk about on your podcast this week?" And I said, I don't think you want to know while we're eating dinner. So we skipped that little conversation, but I'm happy to have it with you today. And part of the reason I wanted to talk to you about this today is there is a new study that is about to start that is designed by Carolyn Mitchell, MD. She's the lead researcher in a study that is just beginning at Massachusetts General Hospital called MOTIF, MOTIF, which is the acronym for Modifying Organisms Transvaginally in Females. The study is all about bacterial vaginosis, or BV, so I thought I'd tell you about the study and remind everyone what BV is, why do we get it, and what problems it can cause, and how to treat it. After that, I'll give you more details about the MOTIF study. The lack of effective treatment is the rationale for this upcoming clinical trial. The antibiotics, either oral or vaginal, that are used to treat BV are effective about 60% of the time. So up to 50% of women who are hoping to get rid of this problem with traditional treatment end up with recurrent BV. A third of American women have this condition, but providers do not know why some women get recurrent BV or how to fix it. There hasn't even been a fundamentally new treatment or prevention strategy in decades. Decades. It is truly a sad commentary on women's health care in this country. Symptoms of BV can include a thin, watery, sometimes grayish discharge, a fishy odor, and vaginal burning or itching or pain with intercourse. The symptoms are often embarrassing for women, and often they will refrain from sexual encounters because of them. And sometimes they'll refrain from even bringing it up to a provider because they're embarrassed by it. However, some women have no symptoms at all, and the condition will be discovered on a routine Pap exam or a Pap report. On the Pap report, they'll say, shift in flora that's consistent with bacterial vaginosis, and that's how we know somebody has it. So even if women don't have symptoms, there are health implications related to BV if left untreated, inadequately treated, or undiscovered. These women are at increased risk for contracting HIV or other sexually transmitted infections if exposed, experiencing complications during pregnancy, premature delivery when pregnant, developing pelvic inflammatory disease, PID, developing fertility problems secondary to sexually transmitted infections and/or PID, and having less success with in vitro fertilization. As I mentioned before, we know very little about BV and how to treat it effectively, likely due to the fact that it is related to the microbiome of the vagina. We've talked about microbiome in the gut. This is microbiome, or, healthy flora, healthy bacteria in the vagina, which is complicated. In fact, many researchers prefer to view BV not as an infection, but as a complex microbial imbalance with a significant role played by the good bacteria called lactobacilli. The healthy human vagina is unique in that it is dominated by one type of bacteria, Lactobacillus. There are many species of Lactobacillus, but the one species, Lactobacillus crispatus, seems to be the best of all. This species is sometimes called the superhero of the vagina. Might not be the superhero you were thinking of, but trust me, it's your superhero of the vagina. Humans are the only animal on the planet who have this special vaginal microbiome. This is what makes it so difficult to study because they can't do animal studies to test treatment options. Obviously, this is good news for rats, mice, monkeys, and other animals, but the clinical trials have to be done either in women or in a petri dish. Lactobacillus creates lactic acid, which keeps the vaginal tissues acidic with a pH of around 4. This low pH level prevents bad bacteria from thriving. The most common bacteria that causes BV is Gardnerella vaginalis. If there is a decrease in the levels of lactobacilli, the pH in the vagina climbs and the area becomes alkaline or high pH. This higher pH provides a perfect home for bad bacteria like Gardnerella. Also, bad bacteria create byproducts that keep the pH high, and the bad bacteria continue to thrive and the lactobacilli levels continue to decrease. Remember that lactobacilli like a low pH or acidic environment. Once this alkaline versus acidic vaginal environment is well established, it can be very difficult to return it to a healthy microbiome. I have patients who can struggle with this for a year or more. Then it finally resolves with aggressive treatment and sometimes may never return, thankfully. But it's a tricky little thing to treat. What increases your risk for developing BV? Well, one is douching, which flushes the good bacteria out of the vagina. I know people think, okay, I've got this odor, I've got to douche, and that just makes things worse. Not using condoms increases your risk. Sometimes semen can change the pH in the vagina, which can set the microbiome imbalance in motion. Having multiple or new sex partners, BV is not considered a sexually transmitted infection, but having multiple or new sex partners disturbs a healthy vaginal microbiome. Wearing tight or wet clothing. Tight clothing prevents good ventilation of the genital area, which creates a good environment for bacteria. Also, staying in wet clothing like a bathing suit or sweat-soaked workout clothes is a risk because bacteria love a moist environment. Using scented tampons or pads puts you at increased risk. Also, poor hygiene in the genital area. If you are wiping back to front after pooping, you will introduce bad bacteria into the vagina. Now, back to Caroline Mitchell and her randomized controlled clinical trial called MOTIF. The trial plan is to transplant vaginal fluids from healthy women and put them in women who keep getting BV. This is why I did not talk about this at dinner with my husband. This transplant is called vaginal microbiota transplant, VMT. Months were spent screening donors to make sure they have a very stable, healthy vaginal microbiome. They are also tested to make sure they don't have any vaginal infections. Then vaginal fluids are collected by using a disposable menstrual cup. Again, this is why no dinner conversation was had about this. The key to the transplant is the lactobacilli, but the research team are hoping that if these transplants are successful, they will show what mixture of things are needed to have a healthy vagina. It could be a combination of things found in the fluid, including bacteria, fungi, metabolites, mucus, nutrients, sugars, and other things. The researchers state that this process is very different than just transplanting lactobacilli. It's putting the vaginal ecosystem from one woman into another woman. Other researchers, including at University of California, San Francisco, are trying the approach of using a vaginal probiotic with the good bacteria but without the accompanying ecosystem to see if it will correct recurrent BV. Those results are not yet available. However, in terms of using transplants in the future for treatment of BV, it can have its difficulties, including risk of infection, limited donation material available, and the bacteria, even in healthy women, can vary from day to day based on things like diet and stress levels. So the donor if you collect on one day, that microbiome could be very different than even the next day of collection. Thus, the goal of this study is not to eventually roll out vaginal microbiota transplants to the general population. I'm sure you're happy to hear that. Ultimately, a goal is to be able to reproduce that vaginal ecosystem in the lab and make capsules that are a lot safer and easier to use. Oh, sigh of relief. Mitchell says that if all goes well, she'd like to see a new treatment available to the public in 5 to 10 years. This is the thing about studies, they take time. The hope, Mitchell has said, is for the third of women who have BV to have a treatment that could actually cure the condition and also reduce preterm birth and HIV transmission rates, which can be secondary to having BV. Or worsened by having BV, I should say. If you are interested in participating in the study, either as a person with recurrent BV or as a donor, I will put the websites in the blog portion of our website, Itchy and Bitchy, under the title New Treatments for Recurrent BV, ? So you might want to just go to those websites for fun to look at the criteria because they're sort of interesting. For instance, the donors have to be abstinent from sexual intercourse for 45 days during the collection period. And I know a lot of my patients would say, sweet, thank you very much. But there are some women who just wouldn't want to do that. Plus, you have to wear this menstrual cup to collect the secretions. So anyway, you have to be very dedicated to be the donor, I think. But it is interesting to read the criteria. And these women are all going to be in the reproductive age. So, and also it'd be preferable if you're in the Boston area, because I think for donors, it's a 3-month period of time that you have to donate or expect, and a 6-month period of time for those who have recurrent BV. Current treatments available include prescription antibiotics like metronidazole, clindamycin, and tinidazole. These have to be prescribed by a medical provider, and the first two are in oral or vaginal form, and the tinidazole is an oral med. Again, there is about a 40 to 50% treatment failure rate using these meds, but they are the most effective options we have currently. There are several over-the-counter treatment options that are often helpful to start immediately after using a prescription treatment. If you have mild symptoms that are not persistent, the over-the-counter treatment options can be useful to get vaginal health back on track. The first option is over-the-counter boric acid suppositories, such as brand name Seroflora, Seroflora, which is around $20 for 28 suppositories. And the usual treatment is to insert one vaginal suppository daily for 7 to 14 days. This works by lowering the pH in the vagina. It is toxic if taken orally, so keep this product out of reach from children and pets. Also, avoid intercourse while the suppository melts, which takes between 4 and 12 hours. Also, avoid oral sex if you are using boric acid suppositories. Basically, it's best if you insert the medication after sex. This company also has a product that, in addition to the boric acid, contains a prebiotic and aloe vera, which help feed good bacteria. Another option is over-the-counter Refresh Vaginal Gel, and this is cleverly spelled Rephrsh. This is a pH balancing gel, and its recommended use is once every 3 days or when pH imbalance is most likely to occur. For instance, after your period or before or after sex. I often recommend the use of a pH balancer once weekly for about 8 weeks following a course of antibiotic treatment for BV. You can use a probiotic that replaces the good bacteria in the vagina. There are many forms or species of lactobacillus, and you want to make sure to get a product that contains the Lactobacillus crispatus. Remember the superhero, crispatus. They are usually other forms of lactobacillus in these products, and that is okay as long as it contains Lactobacillus crispatus. Crispatus, the superhero. Just remember it, crispatus. One such product is Vagibiome by a company called Biome Products, and Vagibiome is Vagibiome. This is a vaginal suppository that contains probiotics and some moisturizers and hyaluronic acid to correct the vaginal pH, and it does contain Lactobacillus crispatus. Using a vaginal probiotic is ideal, but you can take an oral probiotic once daily to help repopulate the vagina with good bacteria. Yarrow brand, Yarrow, many of you have probably taken other supplements from this company, has a good product called Yarrow-Dophilus. These caps are for oral use only. It is not recommended that the capsule be inserted vaginally. And again, this contains Lactobacillus crispatus. Now, see, everybody's going to remember crispatus, so be looking for that in your products. In addition to the use of over-the-counter products, these steps may lower your risk of BV. Avoid using scented tampons or pads or any other perfumed menstrual products. Again, avoid douching. This can disrupt the natural balance of vaginal bacteria and increase the chance of infection. If you already have an infection, douching can make it worse. So if you're having a vaginal odor, try using something like over-the-counter Refresh first to see if it eliminates it. Again, if it continues, you need to be seen to check it out. Wear breathable cotton underwear that isn't too tight and avoid tight pants or shorts. Limit the number of sexual partners you have. Use latex condoms unless you're latex allergic or other barrier method every time you have sex. Don't sit around with a wet bathing suit or damp clothes on. BV spreads more easily in moist environments. Wipe carefully after bowel movements to avoid spreading germs from your rectal area to the vagina. If you are taking these measures and or using over-the-counter products to treat your symptoms and your symptoms are not resolving, please see your PCP or gynecologist for evaluation and treatment to check for other problems that could be causing your symptoms. Please visit our Facebook page, I&B Podcasts, that's I&B Podcast, where you can leave more questions or comments. Our website is itchyandbitchy.com, where you can find blogs with lots of information and websites I talk about in the podcast, including the websites I talked about today. As always, thanks to Forrest Wenzel, our producer and composer of our theme music. Check out his album called An Awful Lot. Go to wherever you stream your favorite music to listen. Just type in Forrest Wenzel or An Awful Lot and it will pop up. If you don't know where to stream music, you can find the album on Apple Music or Spotify. As always, remember that your health is in your hands. Oh, how I feel, bitchy, bitchy.